You guys
Cool,
start
that
over.
is so cool. Thank you.
Start over.
No, don't start over the class.
Okay, so.
Am I up?
Carrie, you're up.
Okay, so first of all, the funds have been approved to be sent to us by the hospital auxiliary. So we,
Starts on page 39.
there you go. All of this up to $75,000, which we are under choices. Done.
Oh, there's.
It's gathered.
So what this is, we have two options here, but let me explain what it is first. So our existing storage array in IS is our production storage, meaning every bit of data that the hospital stores sits on this one particular array. So obviously a very highly critical device. All EMR data, all emails, everything sits right here. Everybody accesses it, and right now support for this first party support through HP expires in December. We must have support for this device because if something were to go wrong, like we have to rely on this, so that there's no option for continuing that support. We've extended it as far as we can.
You're talking about the old machine or the old.
The current one.
Okay.
Right, so that's why we need to replace it. It works great. We plan to repurpose this to store our backups because our existing backup array is garbage. So this will be a big upgrade for that. That's what we're going to repurpose the old one for. So this new one is going to replace this. It's the same brand, but we're going to increase the performance of it as well as make sure that the capacity of it increases as well so that we're prepared for growth. So I am requesting approval for one of these two. The first one is a refurbished one, which totals $44,148. That is what I do not recommend. This is a critical device and we need to buy it new. To put any sort of risk or any sort of additional downtime or any sort of problems on using a refurbished unit, I don't want to do that. But that is an option. A new one is $71,751.70. Again, like I said, the hospital auxiliary is funding this entire project up to $75,000. So we are covered there.
Well,
That's
it's
what I'm
still,
asking approval for.
that's still our money.
It's still our money.
Regardless.
Yeah, right.
But now, I was reading a little bit on it, the warranties and everything, that's on the new machine.
Correct.
Okay. After 5 years, what happens?
We'll probably buy another one.
Okay, okay.
Another array or another warranty.
If they somehow offer an extended thing on this, then absolutely
Yeah.
we'll go for extending that.
Yeah.
It's likely that they will not.
How long have we had the current one?
I think it's 5 to 7 years. I'd have to figure it all out, but roughly right around there. I mean, we have carried it out to as long as we possibly can.
There's enough backup to where that's safe. I mean, you know,
Yeah, so how this works is there's two different controllers on this thing. So all of our data is stored on both. And so if one size goes down or one disk goes down, there's redundancy there. So from a use side, nobody would ever even know that something was down. It would allow us to replace it, as well as we take backups every 12 hours of all of our systems. And then once a week, we send our critical systems backups off to the cloud. So there's redundancy there and it's kind of separated from.
okay, so fire, the worst case, a fire would be 12 hours off.
If we had a fire in IS,
Yes,
it would be more than 12 hours because we'd have a lot more things down, but the
But you still
data
have to-
would be there.
The data would be protected.
The data would be protected, but it would take us, I couldn't even tell you how long
Okay.
to get it back up. It depends on how bad the fire is, I don't know.
but that your system is in probably a fireproof area or reasonably good area.
Yeah,
Yeah, okay. Okay, does any questions? John? Okay, Catherine, John was taking your place while you were gone. Now I'm gonna undo him. You're back.
Thanks, John. Sorry, I had a walk-in client I had to see.
No, that's good. He did a good job while you were gone.
All right.
Nothing. Oh.
Do you have any questions on Carrie's proposal?
No, I've looked it over and I understand what Carrie's saying about having to continue to keep the this one that we have. as a backup also, right?
It would be repurposed to store our backups. It wouldn't be just
Okay.
sit there in a closet. It would be actively in use every single day.
Okay, all right. Yeah, so no, I don't have any questions about it. I know it's a critical part of the hospital and we need to have it, so. And so the recommendation is for it to go with Insight, correct?
Correct. Because that would
Okay.
give us the new one versus a refurb.
Right.
Okay,
Okay, send it to the consent agenda if there's any more.
Yeah, unless there's any more questions.
Okay, we'll send it to the consent agenda
Okay.
with our recommendation if that's. Cool. You can stay or go, whatever
I'm gonna
you
go.
feel like doing.
Thank you, guys. Appreciate your time.
Okay, now that brings us down to. I should learn how to read.
Thank you.
To David.
Financial statement. Is it Dave or David?
Dave.
Dave is fine. Thank you.
Okay,
I can hear you guys okay. Can you hear me?
Yes.
yes,
Okay, let me know if I'm not coming through loud enough. I can project pretty good. So this first part of the agenda, I'm going to be presenting in your packet pages 7 through 21, and my goal is to try to get through that in about 15 minutes or so. And we'll just be highlighting certain aspects of pages as we go through those reports. So we're going to start out right at page 7 of your packet, which is the table of contents. I only want to point out the fact that I've done some customizing a little bit of the report. I've added on page 7, you can see there is a new page B,
Dave,
which
can
has
Dave, can I
trends, graphs.
Hey, Dave.
can I ask you a question in the middle of your, if you don't mind? Now, I'm not complaining, or I just want information.
Oh, no,
Okay, your intro. Now, you're making some pretty major changes.
No,
No.
Not major?
No.
no,
They look like they're
just giving
pretty.
you more information.
what
Hey,
the way
Let's
we've
check.
set it up with Barbara is if and when Chet comes back, he'll be able to, we'll be able to give him the exact same format that he's used to report on future months.
Okay, so we have coordination to where
Yeah.
we're not worried about Chet coming back and not knowing.
I didn't-
what's going
I had
on.
to decide whether or not to, whether to do this or wait till we knew for sure if and when he was going to come back. I decided to go ahead and because it's pretty easy to put back the other way.
Okay, all right, I just,
Yeah, you
just
discussed
for
it with me,
information, just so
I was fine.
we're not doing anything that we
No.
can't.
No,
Okay,
and it's, I'm assuming you want me to do the best job I can possibly. So I'm trying to pick a format that works best for me.
You're doing what Chet was supposed to do before he got like me, old and
This
tired.
is actually a report that I'm very familiar with. Similar to Chet's background, I used to be a BRIM CFO, and I use the same format. Over the years, I've had the luxury of being able to do my own customization. So I just wanted to at least start out with a few minor things that I put in here. And again, I'll be glad to the way it used to be when Chet gets back.
Okay, I just wanted to know the flow, how it was working. It's fine. I just, thank you.
So the next page 8, the first thing that I focus my eyes on is the middle of the page, which is in bold letters, total net surplus, right in the middle of 1,025,122. Do you see that number? That's what our year-to-date bottom line looks like after 2 months. And then you can see the number just to the right of that, 123,492 is the budget. So the good news in a summary form is that so far for this new fiscal year, for the first 2 months, are about 900,000 ahead of budget on total net surplus. The other change on this page was the 3 letters before the word financial strength index on the very lower right corner. I added the ADJ adjusted, and I'll explain a little bit later what I was doing there and why. Part of it had to do with the comment made last month by one of the board members that was so pleased that the month of July had extremely high financial index. So I took the time to research to find out exactly what was going on there. And that's what caused me to make this change that I'll make comments on in just a little bit. So going to page 9, that same report's in the upper left corner as the first graph. And it has some explanations on it. What this new number of 1.24 represents is the same exact formula, except for when we use the, there's really 4 components to this formula. One of them is total margin, profit margin. And what the spreadsheet was picking up was a year-to-date number, which later in the fiscal year might be okay. But when you're at the beginning of any fiscal year, it's probably not a good representation of the organization's overall profitability. It sometimes can be good or bad. So you really want to get a more longer term picture if you're going to measure an organization's overall financial strength. So I made a tweak there, and instead of a 16% total margin, it went down to like 7% over the last 13 months, but it still gave us a good, put us in the good range of 1.24. And then the graph right next to that, am I going too fast or too slow or not?
Nope.
Are you guys keeping up?
So
Yeah,
far.
you're fine.
This is new for me in terms of doing it remotely, because usually I like looking around the room to see if people are lost, and I don't have that luxury right now. So anyway, moving just to the right of that, the graph labeled adjusted financial strength showing the trend since fiscal 19. What I did is I went back and recreated those numbers based on this new formula of using a 13-month average instead of just using the year-to-date total profit margin. And so we have an apples to apples picture of how that 1.24 compares to the prior years. And you can see we're heading in the right direction. So the other graphs are ones that are traditional, used in hospitals.
Dave?
Excuse me? Yeah.
The one thing, if you want to get a good picture, for the last 2 years have been so erratic, and money just falls out of the sky. So
Keep in mind, a lot of our financial strength hasn't even factored in some of that money falling out of the sky, because Chet was careful enough not to show it as profit yet. So it does help in terms of showing the higher cash positions. So that is definitely a fair statement to make, is some of the success that we're seeing on this financial strength index is our higher cash balances as a result of this money falling from the sky.
okay, it's helicopter money is my phrase.
Good point. Good point. And by the way, it's my projections that those types of supplemental payments are likely to slow down significantly this year, and especially next year. I think the IDTs will come back up again, but we're not hearing or seeing that there's going to be as much of that type of unexpected funding, at least over the next 12 months. You can see that the next graphs, I'm not going to highlight each graph. We can talk about it when it's relevant. Perhaps the one that jumps out at me is the ED visits are looking good. The way I calculated the FY22 projected bar, the far right bar in each of these graphs, is whatever the variance was of actual to budget. I assume that same variance going out to the end of the fiscal year. So in other words, my assumption made on all the projected bars, the far right bar, is that we're going to be the same amount over or under budget as we are at the end of August. So in other words, I assume that we're going to hit budget the rest of the year on the last 10 months according to the way it was budgeted. So if we did, that's how we would finish the year in all these categories. So that way we can look at more of really a 4-year trend. Instead of showing monthly information, it's always helpful to look at a longer term perspective. So that's why I went back to fiscal 19 to get a big picture perspective. So how we know how we're doing right now compared to budget and maybe prior year, but how we've been doing compared to the last several years. And this is one way we can do it, by looking at graphs in this format.
Well,
Just below the graphs, we have a concluding summary that's separated into 2 sections that I labeled 1 positive takeaways and 1 negative takeaways for the month, so that you get a general idea of what I think to be major talking points of what the current picture looks like and what was the most recent activity and how does it compare to what we thought would happen. So we really have had a busy summer, and number 1 positive is patient activity, gross charges being up 9.1% for the first 2 months. And most of that came in the inpatient and the ED. The other areas have also strong. Clinic's been strong, and really hasn't been any areas that have really been slow. We already talked about the financial health index going up compared to prior years. Another positive is higher volumes. We're not seeing the corresponding increases in salary and benefits. In fact, you expect at least to be at budget, but we're 163 below budget on the salary and benefits. And I made a comment that some of that is probably due to the fact that we're having trouble filling open positions. And I've just heard that anecdotally. I don't have anything scientific to tell you exactly how many open positions, but I sense that it's a greater need right now than it has been historically. And that when you can't fill positions, you just run short-staffed. So the negative takeaways for the month, actually the number 4 is showing that the fact that we have a 900,000 favorable variance for the first 2 months on our net income. The negatives you can see there, number 1, that the non-patient revenues were lower. I think that was just rebates that hadn't come in this year so far. That was about 50,000 less. Accounts receivable, we're a little bit concerned because we haven't seen those numbers come down. I know they're training some new people. We're going to give them a little bit more time, and I might have to step in there and see if I can provide some assistance and mentoring to try to see if we can get those numbers back into the 60s and 70 days in AR. But we haven't really seen any recent success in getting those balances down. The last item on my negative is the fact I just wanted to point out in general, we weren't expecting a lot the first couple months of the fiscal year, and we certainly haven't received any of these special money from heaven coming in. We only had one over the road check that came in August, and that was it. In general, we'll talk about it later, be several million less this year, expecting on the IGTs and some of the extra COVID money isn't likely to be as high, although today they just started a new phase 4 after I wrote this report. So I'm a little bit more optimistic that there is some new money coming in that is going to help get us a little bit closer to what it was last year. So moving on to page 10, the balance sheet. The only two brief comments I want to make is to make reference to the fact that line item number 1, cash and cash equivalents, is $200,000 less than the prior month. And one thing we can look at that causes cash to go down is line item 23, equipment. You can see the variance there of $413,000. I was going to ask Barbara before this meeting if that was lab equipment that was purchased. There was some major capital item purchased that would have been part of the reason why our cash went down.
Yes, there was lab equipment.
Junior
So
chemistry.
so moving on to page 11, and I'm assuming you're okay with me referring to the page at the bottom and not in the upper right.
Yeah, please.
I don't really have a lot to say on liabilities, except that we are going to talk a little bit more about line item 11, line item 10, excuse me, due to third-party payers, that 13 million number, which is what we're concerned about, how much of that we have to pay back. We'll be taking a lot of time over the next few months, especially with the auditors, making sure that we have a good, accurate number going forward. There was one typo there in the upper right corner. It says audited prior. We still have not gone through the 2021 audit. Although the last week or so, Barbara's made good progress with Rick Jackson, our auditor, and we're well along the way of getting our 21 audit completed. So we are doing a lot of work to get that done. Page 12. So this is the current month profit loss. The numbers that we haven't talked about yet is line 28, total operating expenses. You can see how that number is 2,551,796 on line 28. Oh, that's 154,000 better than budget, and it's pretty close to what it was prior year. If you go to the far right column, you can see that number was 2,513,000. So we're spending about the same amount of money as we did last year. Clearly, a lot of the detail on the expense side, where there's higher amounts, we're still spending a lot more COVID-related expenses than we have historically. And that was also the case a year ago too. So that's why the two numbers are similar. But clearly there is categories of supplies and purchase services that have resulted in much higher expenses due to the COVID situation. Going on to page 13, we have a year-to-date number that's jumping out at me on line 16, contract labor. You can see that number of 209,949. If you compare that to last year, it was 142,000. Now is that the rates that we have to pay for registry has gone up significantly and is probably continue to be a problem for the rest of this fiscal year, where we see the budget variances with higher amounts in the contract labor category. Is nothing we can do about it. It's just kind of the nature of the way things are going. I guess one way you can look at it, if we're successful in keeping all this COVID money, that is paying for some of these higher expenses. So the next thing, let's go to page 14. Like I said, I'm going to try to get through this in 15 minutes.
Before you do, Dave, any questions from anybody on the numbers here, just before we go on? Okay.
Yeah, and that's a good point. I'm going fast, but I don't want you to not ask questions because it's going to be hard to ask a question from 5 pages ago.
Yeah.
So I won't be offended if you interrupt me, although I can't see you right now to know whether you're raising your hand or anything. So I'm trying to get used to this format. Okay, so when I made reference to how we changed the adjusted financial strengths, the line item 33 is what the formulas we're picking up. And if you look at pages 14 and 15, which is the last 13 months of data of each month, and you look at line 33, you'll see that total profit margin was all over the map, anywhere from positive 14 to negative 14%, negative 25%. So it really behooves us to take a longer term average when we look at financial strength and not to look at any short period of time because that number fluctuates so much from month to month.
Dave, which number you were looking at?
I'm looking at line 33 on pages 14 and 15.
That's other non-operating revenue. Other non-operating revenue?
It's actually the percentages below all that on line 33. You see the labeling on the far left, which is what I'm calling the row number.
Yeah, it's 35 and 36 is operating margin and total profit margin.
Oh, I'm sorry. I'm looking at an earlier printout that I changed the numbers at 35 and 36. Sorry.
Okay.
Shouldn't have printed this out before I made that other change. So yeah, that's the total operating margin. You can see how that fluctuates. It's better to take a longer term perspective on that. Page 16, cash flow. I don't have anything major to highlight on that, so I'm not going to spend any time on that. Page 17, which is the activity for the month that Barbara would always do a good job in this detail. You can see the middle of the page, row, the total ER visits 32. How that 1356 is up significantly from what it was a year ago to the far right column. It was 62. That was a 16.6% increase in ED visits this year.
You're breaking up a little bit.
Okay, the 16.6% ED increase from comparing the first 2 months of fiscal 21 to the first 2 months of last year. So that's a significant volume change. On the full-time equivalents, down on row 45, we're pleased to see that a year ago, going to the far right column, you see the number on row 45, which is 225 FTEs. It was down to 210 for this last 2 months of the fiscal year. So compared to the prior year, we're down 15 FTEs. The other statistics I think we talked about is acute patient days, which is on line 12, being higher than budget, but a little bit less than last year. The overall, the activity is pretty strong in most categories. The next page, 18. I don't think. Oh, on 18, have you guys spent much time talking about ratios in general? Does Scott or Barbara spend much time on this page?
No, not
No.
normally.
A real high, usually you have to really like finance and accounting, spend a lot of time on ratios. I would just say that this is where that financial strength index comes from. And if you wanted to highlight the categories that, they're the 4 categories it uses, it's number 2, total profit margin, number 11, days of cash all sources, number 16, average age of plant, and number 19, long-term debt to capitalization. So the person that created that index, he's a guru of healthcare finance. His name is William Cleverly. He's recognized those 4 main areas is what makes an organization financially strong, whether or not the age of your plants is new, whether your debt is manageable, your long-term debt, whether you have a good bank balances in terms of the days of cash, and how much money you're making in bottom line profit loss from operations. So those are the 4 areas that measures the total strength. So page 19, this report I did on supplemental payments, and it's a lot of numbers, and I don't intend to snow you and talk about every one of these numbers on this page, except to make a few comments and highlights on what we're talking about here. So where I want to start out with is something that you should be familiar with, and that's what you see every month when you look at page 6, which is the profit statement. So the box or left side labeled excerpt page 6 from the financial packet, you'll see the numbers that we reported in June of 112 million of gross patient revenue on line 6, and a bottom line net patient revenue of 29 million. So we bill out 112 million. We expect the 29 million.
We lose you?
Excuse me.
We're not
9
hearing.
million is not.
Yeah, where are you at, Dave?
We're at the bottom of label excerpt page 6.
Your phone's breaking up. We're losing you.
Uh-oh.
You there?
Hello?
We
Can't hear you.
Try calling back in.
He was close to it being over anyway, right? Barbara?
Yeah.
So,
Well, I don't know what he wanted to discuss on the other 2 new pages.
well, what I was gonna get at is if you wanted to pick up, then he could go back.
I can't discuss his new pages because
No, okay, I'm talking.
He and I have talked about them a fair amount. I can kind of point out some of the key things there.
You go to, yes, okay. The contract. We're almost there. And behind. Pages.
Hey, Dave, are you still on?
That's just his computer. He calls it his phone.
Oh,
The
that's
audio
right.
is his phone.
Not using, use the audio on his computer. It's kind of the same thing we have with Chet.
Well, numbers going across the phone, sometimes they get crowded.
Yeah.
They clog.
his phone tends to do that though. When I talk to him for a long time on the phone. he'll
Yeah.
start
Here he
creating
comes.
noise.
Okay, I'm back.
All right.
So we're on page 20, and I was trying to make the point, the yellow labeled business office billing related 24,900,000. Do you see that number?
Yes.
Okay, that number is only part of what we accrue or what we assume to be the total amount that is shown as net patient revenue, which is the number on the left side of 29 million. So there's an extra 5 million of what we call supplemental revenue. The traditional way you think of when, because we're a hospital, we have patients come in, We bill those patients and the insurance companies, and we get payments for all those services. That does not represent all of what we bring in, as you guys probably know. So I'm just trying to show you in relative magnitude how much of other funds come in besides what we normally get from the billing office. And what I did on the top part of this analysis is I labeled the types of supplemental payments. So the very top half of the page shows first category, HHS, other COVID payments. That's money falling from heaven over the last year that has yet to be determined. Most of it is still showing up as payables. So it's not going to that 29 million number. It doesn't go to the net revenues until we take it out of payables. The other categories above here is third-party settlements, and that oftentimes be still in dispute and oftentimes still in payables. When it finally does come in, we do it instead of adjusting the revenue side, we actually bring down the deduction, that we have less that we have to pay Medicare, Medicaid due to a settlement. The third category, IGT 8915, you can see on those numbers, they have been really high in prior years, 19, 20, and 21, 7.4 million, 6.5, 7.2 million. Our projection for this year is down about 3 million because the state changed their fiscal year and they're not going to pay out as much IGTs for this current fiscal 22 year. The other categories you can
Switching to a calendar year financial.
The state is?
The
I'm
state,
sorry, I didn't hear.
the state was switching to a calendar year financials, correct?
Yeah, that's what they did.
Right.
Thank
So
you for that
getting 6
clarification.
months worth of IGT instead of the full year. Next year they'll pick it up. Correct for it.
So I have some other categories in there. Some of those don't go to net patient revenue. They go below the line, like auxiliary donations. Those are all helpful payments that help our bottom line, but they don't go to this part of the income statement. They go a little bit lower, called non-operating revenues. Then we also have tax receipts that are also non-operating revenue. And then we have some miscellaneous ones, just to let you know that big number on fiscal 20 in the all other category. You see that number of 2,742,671 in fiscal 20. 2.2 million of that was the PPP payments we got in that year. So that we were able to recognize as a gain when we closed out the June statements, and we show that as non-operating revenue. But that just represents one of the types of payments that come in that's different from what we get in the business office. So you can see the total net receipts. Fiscal 20 was the biggest, had almost $20 million that came in of supplemental money, and that number could go down to as much as 4.8 million as the projection for this current fiscal year. So I wanted to just highlight that to give the board a little bit of a heads up that we don't expect quite as much of the supplemental funds to come in this year.
Well, how would we do if we got a different accountant?
If you got Barbara back, she could probably get you another 20 million somehow. So the positive thing
Right.
that I wanted to
Dave, one thing, I was joking about that because you seem like you know more about accounting than I do, but although the money, the helicopter money.
I think you're right, and to be concerned about that money, I think it's a good point that we have to be.
No, I'm talking about the future helicopter money, the eyes on it. How are we going in the right direction to find it all? Because
I think we are. You have a good staff on hand here And as soon as we find out about opportunities, we're jumping all over it, and we're finding the right expertise to help us maximize how much we can ask for in getting some of these payments. We're in the process of doing that on 2 separate HRSA programs. One is phase 3, the other one's phase 4. We feel really good. We feel really good about how we're doing so far with it, but until it's final, I don't want to, get too ahead of myself too far. But it's a good question. It's clearly worth our time to put as much resources as we can into making sure that we find every possible dollar that's out there and try to bring it in.
Right.
We all do that. It's like I said, I had just alerted Dave and Barbara the other day about the new phase 4 for the provider relief funds are being released. There's about 8.5 billion for rural hospitals that are in their total programs. I think 15.5 billion or something like that they're making available. And so, we have a deadline to hit in order to apply for those funds. So, we all make sure everybody knows or sees these things, so we have an opportunity to put in for them.
Because
So-
it just shows up and sometimes you got,
Yeah,
okay, cool.
exactly.
Thank
Well,
you.
I tell you, when I have to work on these applications, it's amazing how much the numbers change if you put the numbers in the right spot.
Yeah.
We've seen changes of several $1 million on some of these programs just by putting it in the right spot. So it's important to, if we don't have the expertise, to find somebody that does. And I give a lot of credit to the one person at Whipfley who is one of our auditors. His name is Wes Thu, and he made reference to a methodology. He sent me the spreadsheet, and I plugged in our numbers, and our reimbursement went up several $1 million as a result. So that really helped. So that's the important thing, is finding the right people to steer you to so you don't leave any money on the table.
Cool. I figured we were, but if there's a system in place, if there's a way, so we don't miss anything.
Yep.
Cool. Thank you.
So because we haven't recorded a lot of this money yet, there is a pretty high likelihood that over the fiscal year, we'll start showing an increase of net patient revenues, which we would refer to as a prior year adjustment. In other words, the money came in the prior year, but we didn't call it revenue yet. We called it a payable. And now that there's been more time and more research is done, now we feel comfortable knowing that we won't have to pay it back, similar to what Barbara did on the PPP funds in June. So the favorable thing is that we have a good chance over the next 6 to 12 months to start showing that on our bottom line. Not all of it, but parts of it. So let's go to page 21. Page 21, I really want to just focus departments that have done well this current fiscal year on the outpatient side. It's mostly been through the ER, and it makes sense that patients that are sick, that need help, using the services that are highlighted below, the areas of observation, laboratory, X-ray, ultrasound, CT, drugs sold to patients or pharmaceuticals, and respiratory, based on everything going on with how people are sick lately. These are the departments that are getting a lot of tests done, and a lot of charges are getting rung up, and more people are, because the ED volume, as I made reference to earlier, is up 16%. These are the departments that end up putting the load with the higher volume and corresponding higher revenues. So what I also tried to highlight is you can't always just look at the surface. So for example, on the top part, that's also highlighted in yellow, long-term care revenue. If you just looked at that, the middle columns compared to budget and the year-to-date compared to budget for long-term care, you would think they're also having a really good year. But deeper, and you look at the amount of volume, and then you realize that gross charge isn't what you collect. It's what the allowable costs are and what they pay. But the charge itself is somewhat inflated this year because of a rate increase on the skilled nursing that must have been put forth in the budget for this current year. So we're showing like an 18% higher rates in skilled nursing. But the actual volume is actually down 3%. So we can't, even though the gross charges are up, we can't refer to that as a growth department. So I was just trying to highlight the fact that you sometimes have to dig a little deeper and instead of just looking at the surface of numbers where the activity is coming from. Sometimes happens is we have a goofy number in the budget column. So oftentimes it's better to look at how the actuals compare to prior year instead of budget. So I was going to make a quick reference to a line item that's right in the middle of the page, department 4710, near the bottom, drugs sold to patients. But go to that middle column labeled current year budget, and you can see it's a real goofy small number, 8902, when per year of 59,000. So sometimes the budget there's some issues with the budget, so it's probably more meaningful to look at how it compares to prior year.
Dave, on the long-term care, we're operating 66% of capacity, and that's the sweet money is what we're missing. We're paying most of the cost anyway. If we had the patients in there, we'd be having some extra nurses, but it's a higher profit for the last 30%. So we need to try
that's a good point.
We need to get that number up. I know we've had the COVID, we've had problems, but we need to get it back up to about 66 count, or 65 out of the 75. At the 49 is, I'm not complaining right now because we're upside down in everything. But the
Every
sweet
time we get a
money,
patient, it freezes, we can't put
the
any
sweet money's
patients in.
being missed, so
So yeah, there's definitely opportunity there still.
thanks.
One person that needed nursing care, I would be scared to death of seeing the headlines of what came out of New York State with all the people that passed away in nursing because of what the government was doing there. So, I don't think we had a very good reputation in general, the whole industry. People are going to be a little bit more cautious before they send their loved one to a skilled facility. That's my own personal opinion.
Hey guys, I have a request. Tiffany's got to go pretty soon. Can she present her capital request?
I'm pretty much done with my piece here. So yes.
Sorry, I didn't know she was on there. We could have.
Yeah, we could have done it earlier. I didn't realize we did it.
Yeah, we do her now?
Yeah.
Okay, Tiffany, if you're there, you're on.
Okay, hi. Yes, so I just have the request for the new cafe ice maker machine. It's just replacing the current ice maker due to it is out of operation and we need a new one. So Christine and I looked at different options, and repairing it isn't worth the cost. So what I've presented is the price for a new one, and then adding in a water filter to help, since it does also dispense water and the ice as well.
Okay, I've read over it. Does anybody have any questions on it? Okay.
We need it.
I can't see any reason why we wouldn't send it the consent agenda.
Right.
Looking at it, but just one question. what do you do with the old ice maker?
What will we do with it?
Yeah.
Maintenance will just keep it in, they usually just keep it in storage, and then should ever anything go wrong with, which obviously it can't be fixed, so there's not much we can do with it, but
I was just saying about churches or
Stuff like that.
somebody that might donate it to, that maybe could.
but they've tried to fix it and it's just not even operable.
Okay, all right, thank you. So does any objections to it going to consent agenda? Okay.
No.
You're.
Catherine, motion.
Yeah, no, I don't have any objection for it to go to the consent agenda
Okay,
for the board.
okay, then send it to consent. Thank you very much.
Oh, yeah, thank you, guys. I'm gonna log off if that's okay.
Sorry we kept you on there.
Okay, no, that's okay. I was doing other stuff. Thank you. Bye.
I can't believe she said she was doing other stuff instead of listening to us.
She wasn't focusing on my presentation. I'm offended by that.
Okay, is it Barbara, are we down to you now, or?
Yes.
Yep.
Page 22, you have the cash flow projections, and that's the total budget, actual, first 2 months actual, and follows through for the budget for the next 12 months.
Now, what page is that?
That's on page
Page 22.
22.
Okay.
It just shows you where we're at. And on page 23 gives you the actual month activity to the projected activity. We collected 2,298,000. We did get some HQAF money in that 500,000 that's in the miscellaneous cash. We paid out 2,364,000. And then we deposited 100,000. We're making $100,000 a month payments on the new bond to make sure that there's funding for the payments when they come due. Left us with. Yes?
Question?
The only thing I was gonna add to that was that these projections, when we're comparing the projections, you did it the way Chet showed you in terms of using prior year. Prior years sometimes is a good determiner of future payments, but because we just talked about the fact that this year might be a lot less than prior year, our projections, we might be bringing down our projections in future months based on what we're seeing and what we're hearing. So the numbers that we're showing going out for the rest of the fiscal year are probably a little bit high.
So we'll just be tweaking what the projected budget was to
Right.
make it more accurate.
Dave, in figuring what we've got to pay back, however they figure it, if we paid part of the bond down, say 5 million or whatever, could that help us not have to give money back? Is there you see what
Yeah,
I'm?
that's a good question. I asked that same question. I think the two are separate. I think when they give out money, it doesn't hurt you for future money. They seem to be separate categories that they just want to see proof that the revenues lost and the extra expenses, as each one of these programs comes out, that you're not penalized when you have, or you're not given any benefit because you gave back money in the past, and therefore we're going to give you more money later on. That I don't think those two are tied together.
Okay, all right, just I'm looking at every angle. Thank you.
Any other questions about the cash?
No, it looks good.
The following page 24 is the local vendor list. Does anybody have any questions on that?
Okay, local vendor. I won't mention it,
What?
the gas. I think it's over and ready to go.
Well, I think his question before was about the payments made to AmeriGas and why those weren't listed on the local vendor, but we don't pay it.
Just not a local vendor.
So when you
That's
pull
why.
up the
Well,
local,
and then we haven't purchased any gas propane since
Yeah.
about March. And yet we paid out $16,000.
No, the last one
it was in May.
Okay, we weren't supposed to order in May. we were in negotiation and he said we didn't need it. But that's history now. But,
But we do have lots of
okay,
We
AmeriGas
have other
accounts
accounts,
with
yeah.
all our outside buildings, and the apartments
Okay.
are all on
all right,
AmeriGas.
then why are we paying more money for them? Why are we? Who's controlling that?
I'm not sure what you mean.
Well, AmeriGas is charging us about 30% more than the company we're currently with.
Only for the bulk storage. The only thing we bid with was on the bulk storage.
Have we had the other ones?
No, we're on Kern for the clinic. We're on Kern for
Okay,
one other one.
okay. It's obvious
Counting,
they're
yeah.
charging more money. Why don't we bid the other ones? I mean,
We'll go back and get them. I
who
mean,
does that?
well, again, part of it was the gas for the apartments. I don't know if that was under the apartment control and we're just paying that, or whether it's a contract for us.
I don't
It
know.
sounds like almost a compliance issue with fraud, waste and abuse. Who controls that? How can we pay
We'll take a look.
and not even look at it?
Let's take a look at the contracts that we have and so forth.
We don't have any contracts.
Okay, well, then we gotta go back and take a look and see what we're paying, what we might get from Kern Propane and see. Right now, their costs are through the roof right now for Kern Propane. I got a call from Leon on that.
Well,
So,
that everybody is.
yeah, exactly. So there may not be substantial savings there. So we'll certainly look at it though. We'll bring it back to meeting next month.
Okay,
Okay?
and if it helps, Dave, I
Uh-huh.
wanted to keep our governor there if you are working with them.
Yeah.
Okay, thank you.
Any questions on that?
No, I'm sorry.
That's okay. The page 25 is your contract list for the month, the ones that will be coming up within 90 days. Did anybody have any questions on any of them?
That one on law office, there's no way he's worth $1,500 a month. Is he? I mean, did we?
We use them a lot. Okay.
I'm joking.
For,
I have a question on the pre-employment for the background checks, and that just says various. So is it just depending on how many people we hire, or?
No, it depends upon what kind of checks they have to do. Nursing and that, there's a lot more checks versus just a clerical person on some things. So the price for the different categories is all different. And then we're only billed for, when we do any checks.
Okay, so if we haven't billed anything, it's not going to say anything there, or is it going to continue to say various?
It'll be, this is just the overall contract. There's not a set
Right,
every month.
okay,
Various.
thank you.
That's all.
That looks good, looks good. Okay, we have
just,
got,
there was a point too on the contracts, Abbott Laboratories is coming off, that's terming. That's our old chemistry analyzer, so that's gonna be coming off. There were two agreements on two different machines. One has already been termed and the other is ending in, which is this one here. And that's not gonna be renewed, so. The top
Because of the
one,
new lab equipment she got.
yes, so this one will be dropping off.
okay, is that it? We're done? We got everything else taken care of, right? So the meeting is adjourned, right? Catherine, you have anything else?
I do not have anything else.
Okay. Thank you for letting me tumble through this today.
Okay.
Thanks.
All right, thanks, everybody.
Thank you.
Somebody say
I'm sorry, I didn't hear what was just said. I'm sorry.
Oh, we're just concluding the meeting.
Oh, okay.
Yeah, we're just talking about the lab contract for the service and stuff like that.
Can I get your phone number in case I need to call you when I got a question rather than wait until the
Yeah.
meeting?
That would be great. My number is 906-768-993.
Slower.
Okay, give it to me again.
We'll give it to him.
906-768-9306. Excuse me, 909 is the beginning part. 909-768-9306. And I would welcome any board member that way, because I'm really not I should be pausing and asking you guys if you have questions instead of just keep